distancing is crucial to avoid contracting COVID-19. But how do the millions of migrant workers in high-density hostels around the country keep their distance? And what's been done to ensure their safety? Vanessa Burger, a social activist who works closely with hostel dwellers, is on the line now from Durban to give us this information. Vanessa, good to have you, and welcome to the Rundown. Now, as I've mentioned in my intro there, you work on a regular basis with migrant workers, high density, hostels, is where, of course, they're situated. What is the reality on the ground? I mean, in terms of their health, their hygienic habits, as well as their safety during this time?
Well, the conditions in the hostels have been appalling for many years. It's basically a crisis been waiting to happen since they were built. Overcrowding is standing at virtually double with the carrying capacity at most hostels, that they were built to accommodate. And things like social distancing is an absolute fantasy. Residents are forced to share a room in many cases with, say, up to 30 people. The hostel communities have been begging for the municipality to address this for decades, but nothing has been done. This morning, eThekwini municipality announced that they'll be putting sanitizers in hostel bathrooms. But, this kind of thing clearly indicates a divorce, that they are completely divorced from reality, because the hostels don't have individual bathrooms, only dilapidated ablution facilities, that are often not working, poorly maintained, irregularly cleaned, and are shared with dozens and dozens of other people.
So you're saying at this time, Vanessa, that there hasn't been any, measures taken in hostels, specifically from where you are active, at least as a social worker or as a social activist, rather, where, sanitizers have been delivered, where information, awareness has even been raised in those communities?
No. There's definitely no information whatsoever given out, and no measures have been put in place. But the other problem with hostels is the fact that, they are sort of breeding grounds for other diseases that are actually far more serious than COVID-19. For example, TB. The TB incidence rate in hostels is enormous because of the overcrowding, because of poverty, and because of the poor living conditions. At the moment, we are currently sitting with a man in Addington Hospital who desperately needs an MRI scan to find out whether or not he has TB. He suddenly lost control of his legs over a week ago. He has to have an MRI for proper diagnosis. He can only have the MRI done at Alberton Hospital. But apparently he was told that the health minister has instructed Albert Luthuli to only accept COVID-19 related emergencies.
Right.
Now with TB, speedy diagnosis and treatment is so important, especially in communities like the hospitals.
Yeah.
Now, this man, if he does have TB, which he does not know, he will require urgent care. Now, the minister has announced that all the COVID-19 infected patients currently in hospital are not critical and have not been put in ICU. They are there for assessment purposes only. But here we have a man who desperately needs diagnosis and proper treatment,
right,
not only for his own health, but also to prevent contagion in his community, and now we cannot get that diagnosis.
Yeah.
So this is also, problems that hostel residents are facing.
Right. And due to time, Vanessa, just before I let you go, I mean, because you work with migrant, dwellers on a regular basis, these are communities you're exposed to regularly. What urgency and priority do you think government needs to put in place, specifically around this time, and also just with other illnesses and potential dangers that you see in those communities?
Well, there needs to be a rollout of facilities that are available in the hostels themselves, centres of information, treatment, availability of treatment. The nearest hospital to, say, Gleeton's Hospital, for example, is Prince Mshini. Now, last week, some of the residents contacted me to tell me that most of the taps were not working in the washrooms and the toilets. There was no soap. There was no toilet paper. Now, that is common to many state facilities, which are, in most cases, the only public health facilities that, the only health facilities that hospital residents can access.
Right.
They need information on where they can go if they start developing symptoms, not only, for COVID-19, but in a lot of the cases, TB treatment, HIV treatment is delayed, or it is not readily available. So all of those kind of things need to be addressed. But the current measures that are in place are unrealistic for poor communities on the ground. Informal settlements, workers who do not have regular jobs, all of that kind of thing. This is just completely unrealistic. The government needs to really see what is happening on the ground and to come up with plans that are going to address this.
All right, Vanessa, I'll have to leave it at that. Vanessa Burger joining us right here on The Rundown.